in the House. The Secretary will read the messages.
Mr. President, I have the honor to announce that the House has acceded to the request of the Senate for the appointment of a conference committee consisting of 5 members of the House on the amendments adopted by the House through the following Senate files. Senate File Number 9, a bill for an act relating to state government establishing a biennial budget for Department of Employment and Economic Development. There has been appointed as such committee on the part of the House Newer, Eklund, Olson, L., Berg, and Hamilton. Senate File Number 9 is herewith returned to the Senate. Patrick D. Murphy, Chief Clerk, House of Representatives. Mr. President, I have the honor to announce the passage by the House of the following Senate file herewith transmitted. House File Number 2, a bill for an act relating to education finance, providing funding for pre-kindergarten through grade 12 education. And House File Number 52, a bill for an act relating to capital investment, amending prior appropriations for capital improvement projects. Patrick D. Murphy, Chief Clerk, House of Representatives.
No action required. Fourth order of business, the first reading of House bills. House Files Number 2 and 52 have been given their first reading. Senator Johnson.
Mr. President, I move that House File Numbers 2 and 52 be laid on the table.
All those in favor say aye. Those opposed say no. The motion prevails. We'll now move on to the fifth order of business, reports on committees. The Secretary will read the committee report.
Senator Rosen from the Committee on Finance, to which was referred House File Number 33, a bill for an act relating to health, reports the same back with a recommendation that the bill be amended as follows. Delete everything after the enacting clause and insert, and when so amended, the bill do pass.
Senator Johnson.
Thank you, Mr. President. I move that urgency be declared within the meaning of Article 4, Section 19 of the Constitution of Minnesota.
Senator Johnson. We need to adopt the committee reports.
Very well. Mr. President, I move to adopt committee reports.
Yep. On the adoption of the committee reports, all in favor say aye. Aye. Those opposed say no. Motion carries. Senator Johnson.
Mr. President, I apologize for that last move. Mr. President, I move that urgency be declared within the meaning of Article 4, Section 19 of the Constitution of Minnesota with respect to House File Number 33, and the rules of the Senate be so far suspended as to give House File Number 33 its second and third reading and place it on final passage.
All those in favor of the motion say aye. Aye. Those opposed say no. Motion carries. The Secretary will give the House file its second reading.
House File Number 33.
House File 33 has been given its second reading. Senator Benson.
Thank you, Mr. President. House File 33, as amended in Finance, is the Omnibus Health and Human Services Finance and Policy Bill for the upcoming budget year. We received a $100 million general fund target. We also resolved the $100 million in expected savings from the Blue Ribbon Commission with a transfer out of the reserves. So when this bill moves forward, $100 million will be transferred out of the reserves. We also received $59 million in CRF funds. And in addition, we received federal funds in the form of enhanced HCBS FMAP, the Child Care Block Grant, Emergency MFIP, and the mental health. Did I mention the mental health block grant? So members, in the spreadsheet that you see before you is incorporated $685,835,000 of HCBS FMAP that appears as general fund spending. I was joined in work on this bill by Senators Abler and Hoffman, and I'll let Senator Hoffman speak to those provisions in the bill, but I need to be clear to everyone, they came at their portion of this bill realizing the value of every person, working on independence for those who are disabled and elderly, providing stable support for seniors and persons with disabilities. knowing that mental health and substance use treatment in the state of Minnesota needed reform and support, and coming out of COVID were going to be particularly important. Restabilizing our child care system. COVID has disrupted so many things, but if we're going to get our economy back on track, stability in child care matters. We focused on sustainable fund balances. The House, in many of their positions, was aggressive, drained all the funds, and created huge general fund spending in the deep tails. It was a significant battle, and they fought hard to make sure that PCA funding was available to help people in our community. For my part, the stability of our health system as we recover from the impact of the pandemic was important. Respect for the work at the Department of Human Services and the Minnesota Department of Health is reflected in their operating adjustment and policy reforms. My goal was sustainability in the Healthcare Access Fund, so we would be prepared for a future healthcare crisis, or if there's a recession and we need support for our state healthcare programs. We learned lessons from COVID, and they are reflected in this bill. Telehealth, mental health support, substance use. The stress that our public health system went through showed us they needed more funding and they needed reform and innovation. And there was stress on hospitals, and so there are provisions here for mental health beds, both pediatric and adult, as well as med-surg beds for Regions Hospital. We worked to stop the expansion of government control of health care. The cross-subsidy between our private market and our public programs is real, and our system can't remain innovative and forward-looking if it is not also stable. We kept out the governor's carve-outs. With the exception of dental, there was a significant investment made in dental, and one of the House requests was that there also be a trigger so that if goals aren't met, 55% of MA and Minnesota Care dental patients receiving an annual visit, that there would be a trigger, and we would look at a single administrator as an option for the state of Minnesota. And so I appreciate the intensity of the debate over how we fund dental and how we hold that spending accountable, but I think we struck a good balance, and that is in this bill. We included an asthma program as an MA benefit. We supported moms and babies. We did some reform to our prescription drug system. We fixed the family glitch. The Affordable Care Act, I think, had its final decision at the Supreme Court in this last week. The family glitch has been a problem since the Affordable Care Act was passed, and this was another concession to the House. We did, with the help with consultation from the Department of Human Services, continue some of the COVID waivers so that they have access to federal funding that would not be available if we ended them abruptly. It also helps off-ramp some of those programs. Significant provision. As a result of COVID, we have approximately 180,000 non-FBI compliant background checks. We are putting in a new system in the Department of Human Services, and we are giving them 1 year to catch up on all those background checks. That it's important, and we also fund some grants for child care entities so that they don't have to pay twice for background checks. In the Health Department, Senator Housley's Vivian Act that informs parents about the cytomegalovirus and the birth defects it can lead to, but also includes that in newborn screening so that children who might have contracted that virus during gestation or delivery can be treated early. We created a hospital and doula curriculum so that moms of underrepresented communities can have support during that time in their life. Back to hospitals, we expanded mental health beds and expanded med-surg beds. If hospitals are closing, they have to give 120 days notice to the commissioner and to the public, and then the commissioner is going to hold a public hearing so that the members of that community impacted by the loss of that hospital will have an opportunity to have their concerns addressed. Note there's an exception for disasters or if you simply cannot provide the service. For example, you can't have an emergency department open if you don't have a general surgeon. If you can't find a general surgeon, you don't have to give 120 days notice. let's see, significant reform to behavioral health boards on behalf of rural and underrepresented communities. The Senate did retain our opioid provisions except for the medical gas fee forgiveness. We could not get the House to move on that. Senator Rosen's telehealth article stands on its own. Few changes. We do sunset audio only at the same time in both public programs and private programs. There'll be a report at that time, interim, to tell us how audio only is working, and then at a later date, there'll be a more full report for the legislature to review. Under economic supports, Senator Abler carried significant reforms to the SNAP error rate and counting self-employed income as part of your SNAP benefits. The House came to us with a large request for MFIP grants. We settled on a COLA, so there will be a steady cost of living adjustment in MFIP. That was a significant concession on the Senate part. There is also included on your spreadsheet MFIP one-time federal funds. They were given to us as part of the American Rescue Plan, and they had to be spent on the MFIP population. Senator Abler tried to get them placed in more innovative ways, but the House requested a one-time grant, and we acceded to that position. Child care, reform the basic sliding fee, move the CCAP rates to 40% to the most recent market survey for infants and toddlers. That should encourage more child care providers to take infants and toddlers. They were also given improvement grants and child care workforce grants. There was work in child protection for North Star kinship, and that there's court-appointed counsel for families and child protection. In Article 10, Senator Bigham worked with us closely, as did Senator Matthews, on mandatory reporter provisions for private and public youth programs, and we're also reinstating the legislative task force on child protection. Behavioral health includes school-linked behavioral health grants, increased per diem for residential crisis stabilization services, and significant reform in SUD. Let me see as we go down. Members, those are the most significant provisions of this bill. I would be happy to ask, Senator Hoffman did do significant contributions to this bill and working closely with Senator Abler, and would be happy to hear his comments as well.
Senator Hoffman.
Thank you, Mr. President. Members, in this legislature, words are more than text online or paper. Words have a power and authority that shapes our state and every aspect of life. This bill, Mr. President, shows that when individuals set aside party differences and focus on the unique needs of Minnesotans, we get things done. Thank you, Senator Benson and Senator Abler, for including our office in this discussion throughout the entire process. You two were true to your words about focusing on our work, and for that, Mr. President, this senator is grateful. The words of this bill help uplift those in the most challenging situations. They protect and expand independence for those who need it and heal those living with the variety of circumstances. This was a collaborative labor of love, and I would like to thank DHS, particularly Christy Grom, Elise Bailey, Matt Burdick, for their technical assistance and commitment throughout this process. Senator Abler would like to say that, as well as Commissioner Harpstead, you have a valuable team here whose input on where our services are and what they could be was instrumental in getting this work done. Thank you to the other body and their staff. Being responsive, and I know Senator Benson and Senator Abler, this long process as we navigated the then 960 original pages to now 486 with over 1,806 spreadsheet lines and 16 articles to come to this agreement, Mr. President. Thank you to the advocates and organizations, particularly ARM, MORE, Aspire, NAMI, March, and the Disability Law Center for their input, and of which Minnesotans can be grateful that they were part of this process as well, Mr. President. And you know, one of the things is Rick Cardenas, who was passing this year, he would remind us to keep focus on the needs of others. And with that, we named the funding of the ACT network of self-advocates to the Rick Cardenas statewide self-advocacy network. And none of this, Mr. President, would be possible without our Senate staff, council, research, and those analysis folks, specifically our committee administrators, Bailey Strand and Brittany Johnson, all along the way. Their involvement in this bill at all levels kept track in the chaos to ensure it ended up in a proper order. To Kevin Parker, who was deeply involved in the research and work on this nonpartisan process, and his counterpoint, Tom Brennan. See, Mr. President, if people are willing to set aside political brinkmanship and work on a desired goal, good things happen. And these staff have had to work wild and ridiculous hours to bring us to this point, and they all deserve the highest recognition. With that, Mr. President, I want to highlight some important parts of this bill. Number one, we look at disability services. There's a parent-to-parent has ongoing funding throughout the next biennium that ensures the peer-to-peer network. That's important for parents to understand how the system works, how the system doesn't work. Parenting with disabilities, parenting support study and implementation so that parents with a disability have support in child rearing tasks. Senator Franzen was the one who brought this. This is something that had been in the works for a few years. Through this discussion, Mr. President, it became evident that this wasn't just a pilot as originally started, but rather it should be a systems approach. So once again, Senator Benson, Senator Abler, thank you for taking that nod on saying this is a systems approach. And it's globally determined that is indeed a systems need. On the PCA side, Mr. President, there's a rate increase to make PCA wages more competitive. This provides proper pay in the valuable work as well as assist in stabilizing our PCA programs to help address the shortage that limits service availability. This bill directs a new service to be developed that includes PCAs to attend their clients in short-term acute care hospital visits. Unbelievable that they couldn't do it in the past. And basically, PCAs, Community First Services and Supports, will be able to drive their clients, giving that alternative services or duplication of efforts and allow an individual to go where they need to go and when they need to do their services. And Mr. President, it's also noted that the Senate, we were able to keep the non-emergency medical transportation, NEMT, whole. That was huge, Mr. President. So as Senator Benson has mentioned, there's a whole piece on independence and accessibility, the telehealth services, which gets the accessibility, as so many individuals through this new norm of this COVID realized that they were not able to access centers or get out of their homes. The other thing we did, Mr. President, is informed choice. The Olmstead provision of 1999 Supreme Court decision said that people with disabilities have a right to live in the community, they have a right to work in the community. And there's a piece in there that talks about informed choice and options. And so 2 years ago, we had a bill that highlighted informed choice statutory. Well, now we have language that addresses it across a breadth of our system and makes it more transparent and more accountable. Are we talking about informed choice for people's services? We also limited the ability to place people in corporate foster care homes. We looked at Waiver Reimagine, Mr. President, and the extensive work that was done. We have language that we now feel addresses the system need and changes, most notably a stakeholder group that will assist the commissioner in implementing as that system moves forward, ensuring information is disseminated and whose stakeholders have a voice, but a pivotal part in guiding the process. We also, through the conversation, established a special minimum wage task force grant, right? This is not a mandate, Mr. President. This is putting together the best minds of providers, agencies, and most important, those people that are affected by the issues to come together and work out a recommendation to the legislature. Additionally, there's $14 million in grants to assist organizations to help transform from utilizing special min wage to provide other services. Mr. President, I'm going to highlight this again. This is an optional program that can help make important transitions for providers through positive financial support and guidance looking at the overarching piece. And why did we pick it up? Because on the federal level, Mr. President, they're already moving ahead in this direction. And it's better to be prepared and ahead than caught behind and forced to start the process late. Mr. President, elderly waivered services, there's a rate increase for that. This supports services for our elderly. And as we take care of those in the dawn of life and throughout their prime, we must always remember that the twilight, this is an important example of how this legislation supports all Minnesotans in every situation. Between stabilizing services and enshrining their right to choose in our statutes, we expanded independence and made it clear to the legislature of Minnesota supports and protects opportunities no matter the circumstance. Everyone deserves dignity, respect, and the ability to live and thrive in our communities. And with that, there was a package, Mr. President, substance use disorders and mental health. We're funding utilization of a pilot that looks at integrating services and substance abuse use disorders network. And what we found is the app that's using and the research that's going to be done through St. Olaf College, typically, you see a 30% success rate in substance use follow-through. We're seeing that utilizing this app and these programs, you're going to get upwards of 80% success in staying in recovery. This bill protects rate enhancements for substance use disorder services and builds to provide providers providing quality care for those struggling. There are grants in here for adults and children in a variety of ways, from supporting the expansion of mobile crisis services and including providing school-linked based mental health and substance use disorder grants. Finally, there's a culturally informed mental health task force that would help us look at the services and the unique needs of all Minnesotans. I would hope that when this task force is set up, that they do look at intersectionality and that bridges across all of this. So those funding of this bill to expand services, these are the services that are core and root cause services across our state, Mr. President, and we will help find those some support in incredible ways. And if help is needed and more resources, it's really important that without the proper resources, it affects people in negative ways. There's a child care reimbursement piece in there. We actually in the Senate had a higher target than the other body and the governor, but we got it. We moved to the 40th percentile for infants and toddlers and the 30th percentile for preschool and school age. For years, it was just at the 25th percentile, Mr. President. For legal non-licensed family child care providers, we go from a 68% county maximum now up to a 90%, and these rates are set through 26 and 27. Child care, public health, and stabilization grants were also addressed. So these illustrations of the 484 pages are just a snapshot of the many ways we've invested in protecting our children. There's also housing supports increased by $50 a month. Senator Kunish will probably want to comment about the new ombudsperson for American Indian Families Office, and I believe that she has some words for our body on that later on. Minnesota Family Investment Program, one-time payments of $435. And, Mr. President, a cost of living adjustment annually based on CPI. That's a first. Homelessness supports for emergency services grants, a flexible fund for homelessness providers, emergency shelter grants for increasing bed capacities. And those are community living infrastructure to help people with disabilities with housing instability get housing. Mr. President, we still have much to do as there's still a silo of jurisdiction within this realm between DHS and housing, and we have to figure a way to branch those two or bridge that up so that everybody gets it. So, Mr. President, in short, this bill impacts so many vital areas of our life. It's a bill that will save lives and it improves the quality of life and supports our citizens at every moment that they need it. And thank you again to everyone who helped to make this possible. As many organizations have highlighted, that this is the best work they have ever seen in this legislature in a long time, and it's testimony to the many letters of support that we've had. And once again, Mr. President, thank you to Senator Benson and Senator Abbott for making this an inclusive, nonpartisan discussion, and we felt that we were along the way we were included as always. So, Mr. President, I would ask that people vote yes on this. Thank you.
Thank you, Senator Hoffman. Further discussion on House File 33. Senator Rosen.
Thank you, Mr. President. I would first like to thank Senator Benson, Senator Abler, Senator Hoffman, and their team for an incredible bill and the amount of time and attention and devotion and commitment to this very important issue that we face at the Capitol. It was much more complicated with the federal dollars that came through, but we have an extremely important and very good bill before us. Just two, maybe three areas I'd like to just touch on real briefly, and one is telehealth. We started telehealth or telemedicine back in 2015. And the lessons that we have learned from COVID show that there was a 30% increase in telehealth visits last summer, about an average of 15 to 20% overall. Telehealth has allowed a patient-provider care and the relationships to continue and is clearly shown to improve access to care. A press release from the medical director of the Mayo Clinic Center said, "The experience with telehealth during the COVID-19 pandemic has opened everyone's eyes as to the potential to deliver health care in a much more safe and convenient way. And this is especially important now that we have seen an increase in mental health issues and substance use disorder, especially with our youth. So we are well positioned to handle those issues, but we're going to need a lot more attention in that area. Digital care delivery is truly a reality, and it's not to supplant the in-person, but to complement the health care delivery options. But will it result in a lower overall healthcare cost? Where does the value-based outcomes and parity land? And should there be a creation of a new network or network adequacy? These are the issues that Senator Benson is going to be dealing with in the forefront and in the future. And I feel very comfortable that she has the pulse on this for our digital care delivery in the future. Another area that did not get attention on the floor, but is so critical in this bill, is the foster care licensing piece. This is a long time overdue, and it brings Minnesota foster care licensing standard more in line with our adoption standards and removes unnecessary barriers that exist in current law for relatives, especially in our communities of color that are seeking foster care license. The advocates came together and focused on what is best for the children. A special thanks to them and all to our very own Jane Ranum from this chamber, Patty Moses, Sarah Erickson, Rich Graheim, Joanna Woolman, Max Page, and retired Supreme Court Justice Kathleen Page, and to the Department of Human Services. They did the yeoman's work on this, so really appreciate that. Another really critical piece in this bill that I worked for many years, and Senator Benson picked up the, I'm not sure what you picked up, the burden, but you figured out dental, you paved the path, and Senator Benson, you've got a very good dental piece in this bill, so thank you so much. Let's vote yes on this bill.
Thank you, Senator Rosen. Senator Kunish.
Thank you, Mr. President. At this time, I would like to offer the A11 amendment.
Senator Kunish offers the A11 amendment. The Secretary will report the amendment.
Senator Kunish moves to amend House File number 33, the unofficial engrossment as follows, page 233 after line 21, insert. This is the A11 amendment.
Senator Kunish.
Thank you, Mr. President. This amendment is quite near and dear to my heart. It increases the gross income limit for SNAP, supplemental nutrition for our families, from 165% to 200% of the federal poverty guideline, and this is an allowable increase through the federal broad-based eligibility policy. Members, 25 years ago, I was one of those parents that went to the state for help when I needed it. I was a single mom. I was running a family daycare. I had 3 young children, and working part-time as a server and going to college on the weekends to get my teaching degree. At that time, I did my best to save as much money as I could to get me through my student teaching period. But unfortunately, by a fluke, the government went on shutdown, and I wasn't able to get my teaching license when I finished my education and received my degree. There came the night where I sat down at my table and looked at my checkbook and realized I had really no money left. I had a house, I had 3 children, I needed to take care of them. And I remember my dad telling me that the resources that Minnesota has in the form of welfare is there to help families in need. My father was St. Cloud City Attorney, he was Stearns County Attorney, and he also worked very closely with the Director of Social Services in Stearns County. And so he knew the value of investing in our families. It's not easy to be a parent and have to go apply for assistance. Especially at that time, it was almost a shameful experience. I didn't want anybody to know. I didn't even want my kids to see me using food stamps at the grocery store. And it wasn't long ago that one of my daughters said to me, you know, Mom, as much as you hid it, we saw that. So, members, today we are here to ensure that we have those resources available to our families. This amendment increases the gross income limit for SNAP, as I said, from 165 to 200%. 200% is the federal poverty guideline in the highest allowable limit. And there are 18 other states across this nation that allow that 200% for SNAP eligibility. This is an incredibly small cost to the state because it uses federal SNAP funds. In fact, the investment for Minnesota is only $10,000 in fiscal year 22-23. And it's only $4,000 in fiscal year 24-25. That's $14,000 of investment in our investment in our families. So that comes to around $3,500 per year as Minnesota's investment. It's only $291.66 every month. And what is our return on an investment? Minnesota's return on this meager investment is going to make a difference to 3,200 households across Minnesota. For every $1, we will get a return of $1,400 per month. That's over $20 million per year that we are leaving on the table, that we are depriving our families with those food needs and the nutritional values at a deficit. So really and truly, who in their right mind would pass this kind of investment and allow it to go untapped? It is our responsibility as elected officials to invest in Minnesota and to not leverage this kind of return on investment would certainly be a derelict in our duty to our society. If you look on your desk, you'll see that there are some handouts here, and I would appreciate you taking a look at these handouts because there really are the facts. We know that our families have especially been in tragedy during this COVID pandemic, and many families who were once very secure are now going to food banks, are looking for other assistance to feed their families. If you look on, there's one that's raising SNAP income limit. On the back, you'll read the story of a retired couple. Imagine age 73 and 74, and your retirement doesn't cover your food needs. This is a real tragedy in this state, and we can make that little tiny investment, that investment of $291.66 a month to ensure that families with children, that adults, that are elderly have the nutritional resources available to them. How can we let this money go from the federal government? How can we not invest in our communities? And so, members, I want you to take a minute and ponder this, and I'm hoping that we can really address the increased food insecurity and the hardship that is coming out of this COVID-19 pandemic. There's one statistic that by July 21st in 2020, 37% of Minnesotans reported some level of food insecurity. That was a year ago. Imagine what it's like right now. If you knew, and now you do know, so you have to, it's our obligation to make that difference, to leverage $1 to get a return of up to $40 million to put food on the tables of our family members, your neighbors, your family members, your constituents, and you don't take advantage of that. How is that being a good steward of our communities? Let's put our personal and our political ideologies aside. Let's make this tiny, tiny investment in addressing hungry children, our adults and elderly. And members, I would ask you to vote green on this amendment, the A11.
Further discussion on the A11 amendment. Senator Benson.
Mr. President, this item was presented on the House spreadsheet 4 times, and when I asked if they were going to incorporate the work requirements, it no longer appeared on the spreadsheet. The House gave up this position, and so I'm going to ask for a no vote.
Further discussion on the A11. Senator Johnson Stewart.
Thank you, Senator Jasinski. I would have a question for Senator Kunish. Will she please yield?
Senator Kunish will yield. Senator Johnson Stewart.
Senator Kunish, I was taking notes when you were talking. Did you really mean to say only $10,000 in year 1 and $4,000 in year 2, or perhaps you're mistaken? Can you verify those numbers?
Senator Kunish.
Senator, it is $10,000 and $4,000 for a total of $14,000 investment.
Senator Johnson Stewart.
So, Senator Benson, will you please yield for a question?
Senator Benson will yield. Senator Johnson Stewart.
So, Senator Benson, you know I'm new here. I don't understand. If the House takes it off their spreadsheet, can't we still offer it up on our spreadsheet if we value something like feeding families for such a small amount? Would it have been possible for us to put this forward?
Senator Benson.
Mr. President, I'd like to remind the body that there is substantial investment in MFIP, including a large one-time investment for MFIP families. Additionally, let me repeat it again, the House raised this 4 times, and when I asked if they would be adding work requirements, Minnesota currently has our SNAP work requirements waived, and they have for a long time. They took it off the spreadsheet.
Senator Johnson Stewart, do you have a follow-up?
I have a follow-up. Senator Jasinski, I know you're on the Transportation Committee with me. Did you know that a fire hydrant costs $7,000? So for the price of 2 fire hydrants, we could be funding this program, and last year MnDOT installed 25. Thank you.
Thank you. Senator Marty.
Thank you, Mr. President. First, I'd like to ask for a roll call on the amendment.
Roll call requested, roll call granted.
And this bill has lots of good provisions and takes a lot of important steps forward in taking care of Minnesotans, people with disabilities, people who are struggling with health care challenges and all sorts of things. But this is really a puzzling omission from the bill. When Senator Johnson Stewart was asking about, the $14,000 is simply for the administration, the computer programming things. It's federal money coming in to help folks. In terms of a work requirement, I was just reading the handout that Senator Kunish handed out and talking about this married couple, retired, fixed income, 73 and 74 years old. She read that. It says they due to rising prices, everything we purchase and we pay for, we exhaust our 401k. Things are getting tighter financially every day. We retired at age 66 and 65. Thought we had done everything right, would have sufficient funds to live out our lives. But that turns out not to be the case. Do we want them going back to work? Or the mother with 4 kids? They're making $3,600 a month. Falls in the cracks. You know, people between 165 and 200% of poverty, they're working. Matter of fact, a lot of people right now who are right under 165 and are getting food stamps, there are times when many of them work hourly jobs, and they got to turn down extra hours because it'll push them over the limit, and they will lose more money for working those extra hours. So we want to put, because there's no work requirement here, and somehow we think these people are lazy, we're going to punish these seniors, these parents, these kids. I don't get it. I mean, Senator Kunesh, I think you tried to estimate the number, how many thousands of bucks we get for every dollar we're spending in the administrative costs. These are the people who need the funding most. And we're going to turn down $20+ million a year because we don't want to put in $14,000 for that, or because we have an ideological thing that everybody ought to be working because those folks are all lazy. When we turn 65, it's okay to retire, but them at 75, 73, these folks are, they should have to go back to work. I just think this is wrong. I think this is a glaring omission in the bill. It's a simple one to do. I urge your support for the Kunesh amendment.
Senator Wicklund.
Thank you, Mr. President. I rise in support of the Kunesh amendment. When I presented this bill in Senator Abler's committee, I had a testifier from northern Minnesota who spoke about how she was working a lot, or working as much as she could, and her income, unfortunately, would fluctuate enough that while some months she would qualify for the SNAP benefits, other months she would, her income would rise above the 165% of federal poverty level, enough that then she would not qualify, and how it was really detrimental to her family's ability to have enough to eat. She said that she would utilize the food shelves and utilize all other benefits she could find, but if this change were made, if the income limit was 200% of federal poverty level, that would make her life, it would work a lot better. And I think if you look at the handout and look at the cost of living in Minnesota for families of four, what the income limit is for a family of four currently, and if you look at what the costs are for a typical family of four, the figures that are listed add up to more than that monthly SNAP income limit, without even including transportation taxes and other expenses. So I think that this is a very, very small investment that we make as a state, that we can bring in additional federal money that will help a substantial number of people. In terms of number of people it could help, it's possible that there may be over 300,000 people who would possibly be eligible. Those people, if they were to apply for the program, they would have to meet the net income tests to be able to qualify. So it's not to say for sure that they would all qualify for it, but there are a substantial number of Minnesotans who are making under that, who live below the 200% federal poverty level, who would possibly qualify. And why wouldn't we put the small resources into making it possible to draw down the additional federal money and allow them to collect these benefits? Thank you.
Further discussion on the A11 amendment? Seeing none, the Secretary will take the roll. Pursuant to Rule 40.7, I will now call on Senator Frentz to report the votes of the absentee members.
Thank you, Mr. President. Senator Carlson votes aye.
Senator Carlson votes aye. Senator Frantz.
Senator Champion votes aye.
Senator Champion votes aye.
Senator Dietzick votes aye.
Senator Dietzick votes aye.
Senator Eaton votes aye.
Senator Eaton votes aye.
Senator Eakin votes aye.
Senator Eakin votes aye.
Senator Fateh votes aye.
Senator Fateh votes aye.
Senator Herr votes aye.
Senator Herr votes aye.
Senator Latz votes aye.
Senator Latz votes aye.
Senator Newton votes aye.
Senator Newton votes aye.
Senator Putnam votes aye.
Senator Putnam votes aye.
Senator Rest votes aye.
Senator Rest votes aye.
And Senator Torres Ray votes aye.
Senator Torres Ray votes aye. Thank you, Senator Frantz. Next, I'll call on Senator Bach to report the votes of the absentee voters.
Thank you, Mr. President. Senator Tomassoni reports a no vote.
Senator Tomassoni votes no. I will now call on Senator Johnson to report the votes of the absentee members.
Thank you, Mr. President. Senator Abler votes no.
Senator Abler votes no.
Mr. President, Senator Coleman votes no.
Senator Coleman votes no.
Mr. President, Senator Goggin votes no.
Senator Goggin votes no.
Mr. President, Senator Lang votes no.
Senator Lang votes no.
Mr. President, Senator Osmic votes no.
Senator Osmic votes no.
Mr. President, Senator Pratt votes no.
Senator Pratt votes no.
Mr. President, Senator Rude votes no.
Senator Rude votes no.
Mr. President, Senator Westrom votes no.
Senator Westrom votes no.
Mr. President, Senator Kiffmeyer votes no.
Senator Kiffmeyer votes no.
Mr. President, Senator Howe votes no.
Senator Howe votes no. Senator
Mr.
Johnson.
President, Senator Utke votes no.
Senator Utke votes no. Senator Johnson.
Mr. President, Senator Miller votes no.
Senator Miller votes no. Senator Johnson.
Mr. President, Senator Rarick votes no.
Senator Rarick votes no. Senator Johnson.
Mr. President, Senator Gazelka votes no.
Senator Gazelka votes no. Senator Johnson.
And Mr. President, Senator Newman votes no.
Senator Newman votes no. With all those members of voting who desire to vote, the Secretary will close the roll. There being 30 ayes and 36 noes, the amendment does not pass. Further discussion on the House File 33. Seeing none, the Secretary will give the bill its third reading.
House File Number 33, a bill for an act relating to health appropriating money. Third reading.
Third reading. Senator Nelson.
Thank you, Mr. President. I just rise in support of this bill before us this evening. This is a bill that will empower Minnesotans and allow them to live their best lives. I just want to highlight a couple of the issues that are so critical. I serve on the Health and Human Services Finance and Policy Committee and was very glad to offer an amendment that helped with these issues. And I want to thank Senator Benson and Senator Abler for carrying these through in negotiations. School-linked mental health. We've talked about the rising need for mental health services even before COVID. The COVID pandemic has only increased the need for those services. And so many of our students were out of the classroom for so long. They were out of the schools for so long where they were able to get those school-linked mental health services. Mental health services are not things that can be delayed. I'm glad to see that this bill includes increased funding for school-linked mental health services. This is protecting and strengthening the next generation. I also stand to speak about the importance of the child care reimbursement. We talked about this not too long ago on this floor. We are having a child care crisis, and quite frankly, we're having a workforce crisis. And friends, they are tied together. Many moms and dads might choose to go back to work, but they cannot when they don't have a place where they know their children will be well cared for. I'm glad that this bill includes increased child care stabilization grants and supports. This is important for our children. It's important for our workforce. And a good share of this bill, members, is so important to Minnesotans who have some form of disability. Particularly, this bill is increasing reimbursement rates for those personal care attendants that allow about 44,000 Minnesotans to live independently with assistance from the personal care attendants. I'm glad to see an increase in those reimbursement rates, and so are Minnesotans all across this state. Of course, those housing grants are important. We know that Minnesotans need to know they need to have a reliable, secure place where they're going to lay their head at night. Without that, everything else is very difficult for Minnesotans. And then just a couple items that are so important as well that were well addressed, and they've been long-standing items. One, Senator Rosen mentioned, which is the dental reimbursements. Minnesota for a long time has had very low dental reimbursements, and that has meant that Minnesotans have not had access. Minnesotans with financial challenges have not had access to dental care. And we know that when you have a toothache, when you have a dental issue, you can't do anything else. It is debilitating. I'm glad to see that this bill is going to help more Minnesotans get access to needed dental health. And lastly, telehealth, or telemedicine as we called it in 2015 when we passed that first piece of legislation. This is one of the lessons that we've learned through the pandemic.
Sorry, Senator Nelson, could people please keep it down? It's getting tough to hear. I know we're getting close to the end, but if you please keep it down so we can hear Senator Nelson. Thank you. Go ahead, Senator Nelson.
Oh, thank you, Mr. President. Telehealth. We cannot forget the investments and the modernization of our Telehealth or Telemedicine Act. This is going to help people long beyond the pandemic and its recovery. It is going to help more Minnesotans get the great health care they need when they need it, where they need it. So I just want to thank Senator Benson for carrying these through. And lastly, the tobacco prevention funding. This was an important piece. It was going to go away, and I am glad to see that it was carried in the Health and Human Services bill. We cannot afford to go backwards. We have done a great job in this state in reducing youth tobacco use until the vaping epidemic hit, followed by the pandemic. And now it's important that we begin that tobacco prevention, and I'm glad that the funding is there. Thank you, members. I look forward to a green vote.
Thank you, Senator Nelson. Senator Kunesh.
Thank you, Mr. President. While I was very disappointed that you all couldn't support that small investment in our families for nutrition, I am very happy with one part of this bill, and that is the allocation to allow the American Indian ombudsperson to move out of the office and work in an environment in which not only is she surrounded by the support of our American Indian community, but also has the availability to do the work that she really needs to do for our American Indian community. The ombudsperson for the American Indian family investigates complaints for non-compliance of the Indian Child Welfare Act, otherwise known as ICWA. And she also has to support the Minnesota Indian Family Preservation Act and Minnesota statutes, rules, and DHS policies that involve child protection cases. The ombudsperson also collaborates with our tribes, with agencies and counties, communities and organizations, courts, schools, and other organizations to develop policies, rules, and laws to improve the outcomes of our American Indian families involved in child protection system, as well as collaborating on prevention programs. For many of you who don't quite know the facts, our American Indian kids are removed from their families at higher rates than any other group of people in our state. I'm trying to pull up this graph that I have here. Let me just do this here, see if I can get it to flip. There we go. So our American Indian kids have a rate for every 1,000 children in foster care in 2018, 38.4 of them were our American Indian. That compares to 14.8 of 2 or more races. That compares to 8.8 for African American. But the really, really sad tragedy, not only are they removed and put into foster care far from their families and their culture, but they continue to stay in foster care longer than any other demographic of our Minnesotans. 89.3 of the children, American Indian children that are removed from their homes, put into foster care, stay in foster care service. That's comparable to 21.2 of our 2 or more race kids, or 11.9 of our African American. The work that this ombudsperson does is incredible. Her responsibility across the state to work not only with our counties and our cities and our state, but she works with every single one of the tribes. I believe it was in 2015, the OLA suggested that we separate this position out and put them into their own office in order to be able to continue the work in the best way. And it's taken us this long. And so I would like to thank very much Senator Abler for his awareness, his understanding, and his championing of this. I would like to thank all of those that have worked so hard to ensure that this happens, because we know that as soon as we start to really invest in our American Indian families and our kids, as soon as counties understand ICWA law and the rules around our unique sovereign nations, our families will stay together. And I think we heard recently in the news about all the deaths at the boarding schools, not only across Canada, but across the United States as well. And Minnesota itself also had these boarding schools, and I'm sure that we will be hearing more and more stories. The historic trauma to our American Indian communities lives on today. And it is through the work of our ombudsperson and so many others, and those that champion our American Indian communities and families here in the legislature, that we can finally start to put our families back together, to heal the historic trauma and violence. And I thank Senator Abler and the other senators that have worked on this in order to make it happen. Thank you.
Thank you, Senator Kunish. Next, I go to Senator Housley. After that, to Senator Dames. Senator Housley.
Thank you, Mr. President. I do want to thank Senator Benson, Senator Abler, Senator Hoffman, and all of their staff on this. It is a really, really good bill, albeit expensive. It has some really great provisions in there, so I do support this bill. In this bill, there's a provision for a virus called CMV and pregnant mothers who contract CMV. 91% of women do not know about this virus. 1 out of 3 pregnant women will contract it. 1 out of 200 children will be born with CMV, and it can cause some really serious birth defects, with hearing loss being number 1. We had some wonderful, wonderful advocates, many parents who brought their kids here to the Capitol for the last 4 years, advocating for education for our healthcare professionals to educate pregnant mothers about CMV and what can be done with early detection. We also will be the first state in the country to pass newborn testing with the blood spot for CMV, because early detection of the virus in a child can help prevent hearing loss and any other defects. So I support this bill 100%. I want to thank everybody on the HHS and especially Senator Benson, who fought hard for this provision also, and to the advocates. Thank you, and I will be encouraging a green vote. Thank you.
Senator Dames.
Well, thank you, Mr. President and members, and I just wanted to stand up. I'll make it very short, but I just wanted to thank the team that worked very hard, including Michelle Benson, or Senator Benson, and a lot of other people on the reinsurance program. And the reinsurance program for the 5th year is included in this bill, and I think that's very important. That is going to help about 50 to 60,000 people with individuals that are in the individual insurance program, help them with their insurance and at a much reduced rate. There is a little change in the reinsurance on the 5th year than what previously we had hoped for. The point where the reinsurance kicks in is still 50,000 as it was previously, and it blinks off at 250,000 as it did previously. But on the co-insurance portion of it, previously it was at 80%. This is being estimated to be at 60%, and that's because of a reduction in dollars that was available for the reinsurance. But all in all, it's a very good program. This also includes the language that requires the Department of Commerce to apply for the waiver for the 6th through the 10th years. So I just think the public needs to realize that this has been salvaged. It's an excellent program. It's proven to work. Many other states throughout the United States use it. Some states have even went as far as to make this a permanent piece of their individual marketplace for insurance. So with that said, this is a very good piece in the bill, and I appreciate it being in there.
Senator Kent.
Thank you, Mr. President. I want to rise and join the appreciation for what is a pretty important bill. It is going to make a difference, particularly coming out of the pandemic, in the lives of many, many Minnesotans, and I appreciate the work of so many on it. I may have missed this, but I did want to single out appreciation for the Senate DFL lead on the Health and Human Services Finance and Policy Committee, Senator Melissa Wickland, who has been dedicated and worked very hard on these issues as well. Thank you.
Thank you, Senator Kent. Senator Dibble.
Thank you, Mr. President, and thank you, members. I too rise to express that there are a lot of great things in this bill. This is a bill that has a lot to be commended in it, and I'm glad to see this bill today, and I do intend to vote for it. I did want to highlight a couple of things, though. You know how Health and Human Services bills are. They're huge, and there's a lot of good things that happen that'll make a positive difference in people's lives. But there are always things that we still need to work on. And I just wanted to talk about a couple of those things to publicly state my commitment to continue working on these as we go into the next half of this legislative biennium, and to request my colleagues here to work with me on these subjects. I've raised these before on the Senate floor, and I invite my colleagues to join me in this work. I do know, and I'm grateful to see that all told, there's probably around $26 million for addressing the issues of homelessness. And we've seen, of course, the tremendous crisis of homelessness that has occurred and exacerbated through the pandemic. And it is a scourge and a shame, and something that we should all be embarrassed about in the state of Minnesota, one of the wealthiest states in the country, in one of the wealthiest countries in the world, in one of the moments in human history when we see more wealth generated, that we have people living in Minnesota who are totally unsheltered or at risk. That is especially true when we talk about homeless youth who are completely disconnected and unaffiliated from their families, have been turned out, and are completely on their own. And members, we don't see homeless youth the way we see adult homelessness as we are driving around our communities, or as we're going to our parks, or walking around our towns and the like. Young people who have been turned out of their homes, turned out of their communities, aren't visible. Oftentimes they're sleeping on sofas, they're being taken advantage of by adults in all kinds of ways. And so we don't see them, but it is an enormous crisis. I'll just read an excerpt from the Wilder Foundation's most recent detailed study on the subject. I will mention that there is direction in the bill to update our analysis and get fresh and new data on youth homelessness in Minnesota, and for that I'm grateful. Additionally, there's a provision that allows for homeless youth to access key identity documents with greater ease, which helps them access a lot of what they need to be successful in their lives, and I'm grateful for that policy initiative as well that's in the bill. But just consider that an estimated 13,300 Minnesota youth are on their own experiencing homelessness over the course of a year in Minnesota. Members, 13,300, which includes an estimated 5,800 minors aged 17 and younger on their own, and about 7,500 young adults who are 18 to 24. And the reason we talk about youth age 18 to 24 is because we all know that when we turned 18, nothing magic happened. We still relied on our communities. We still relied on our families, our parents, for a lot of things, money and support and all kinds of things. So it's important to recognize that upper age bracket. Hennepin County's own numbers show that the number of homeless youth has doubled since the start of the pandemic. It has become just an amazing and incredible crisis this last year. The Youth Services Network, which is the consortium or the coalition of organizations that specifically serve unaffiliated, unaccompanied homeless youth, had to really step up when our schools, out-of-home placement services, mental health services, and on, in large part, just couldn't meet the need, and in some cases were failing our young people. They also had to contend with increases in program costs, staffing problems, childcare issues, their own staff COVID exposures, cancellation of fundraising events, and the like. And members, while I'm grateful that we see such a strong position for homelessness funding in the bill, those dollars, when they're not targeted and they don't flow through the Homeless Youth Act, don't get to these young people. They do serve homelessness in ways that are very, very important, for which I am extremely grateful, and we need to continue doing that. So I'm not suggesting that we don't continue to do this level of effort to address homelessness, but it is very important that these dollars specifically flow through the Homeless Youth Act and are funneled through the RFP process, the competitive grant-making selection process, because what that does is it identifies the continuum of services that these young people need. Think of what we need as young people that we would otherwise get from our families and our communities and the like. Housing, employment, education, health care, youth development, family reunification, case management, connection to community, and caring adults are the kinds of things that are made specifically available through that RFP. And they're delivered in the context and settings of street outreach, drop-in centers, youth shelters, transitional housing, and permanent supportive housing. A lot of this is developed through intensive targeted case management that commences prior to housing and includes vital aftercare services as well. And one area in which we've been entirely deficient is serving young families, young people who have themselves started their own families. So I just wanted to highlight that, as well as another subject. I regret that there is an entire lack of inclusion in this bill of a bill that I had introduced that was brought in on the House side, which waives the co-payment requirements for those who need HIV and AIDS medications, who are on medical assistance or access their health care through Minnesota Care. It had a fiscal note of about $58,000. It's a pittance, but it makes such a huge difference when someone has to go to the pharmacy and they don't have to pay the $5 or $10 copay when they don't have $5 or $10 extra in a month. Members, I just wanted to point out that the reason this small matter is so important is because we've had 2 HIV spikes, 2 HIV outbreaks in Minnesota in this last year, concentrated, one in Hennepin County, another one concentrated in Duluth. And we have adopted unanimously in this body a plan to end HIV in Minnesota, which is really exciting. We could end HIV today if we had the political will and the resources to do so. We don't need a magic cure. We just need to prevent new transmissions of HIV, which we have within our means and our power to do so by preventing new transmissions. If people are able to access care and service, they bring their viral load down to 0 and they're no longer transmissible. Or they can prevent becoming infected if they have access to PrEP, the pharmaceutical interventions that allow you to not contract HIV in the first place. And this measure would help us end HIV in Minnesota. We have about 300 new cases per year, and that level has not changed in about 20 years. 300 new cases of HIV infection in Minnesota every year. And when you consider that every single new case of HIV in Minnesota costs anywhere from $500,000 to $1 million over the life of that person to treat, for $58,000, we would be so much further ahead. I am grateful that we did include the changes to the Medical Assistance Drug Formulary Committee. We've talked about that before. That is in dire need of reformation in terms of transparency and disclosure, as well as who sits on those committees and makes those decisions and how they engage with the public. So that is a positive step after the negative experience we had with efforts to exclude access to vital HIV and AIDS drugs medications last year. But we have a lot to do to end HIV in Minnesota. And so I will continue to work with Chair Benson and Chair Abler and my friend Senator Wickland and Senator Hoffman. And hopefully we can make some progress on both of these subjects next year. Thank you, Mr. President.
Thank you, Senator Dibble. Senator Senjum.
Excuse me. Thank you, Mr. President. Members, I want to publicly thank Senator Benson, Senator Abler, Hoffman, and Wickland putting together this outstanding bill. I often tell people as they come to my office the role of government is to help or do for people that which they otherwise cannot do for themselves. And this bill is a lot about doing for people that which they cannot otherwise do for themselves. It's all about helping people, and frankly, as we think about why we're here, why we come, why we spend that $100 to sign up, why we go out and knock on doors, is to help people. That's why we come. That's our reason for being. And tonight we have a reason for being and for actually fulfilling that purpose. So as we think about this bill, I just want to offer Senator Benson and all involved your help, certainly in the dental area. I had a small periodontics bill. Thank you so much for that. But beyond that, even broader, the vast role of dental and the focus within your bill on the whole dental area. And then certainly the mental health area. This one touches me because I just think this is so important. And we're on a mental health journey in Minnesota that I'm extremely proud of on a personal basis, and we're all part of that, and we're all part of joining hands and trying to deal with this issue that we have. We have it all over the country, all over the world. But I think Minnesota stands tall in this area, and we're getting taller and taller each year as we go through our exercise here at the legislature and continue to build on what we've built on. And so Senator Benson and all involved, certainly thank you for that. And then I come down to things like personal care attendants and all the work that they do and how important they are to the lives of so many people. And this bill is going to help along the way there too. So many good things in this bill. Thank you so much for all involved that put this together. I'm hoping we see 67 green votes up there because that's the kind of response this bill needs, and I hope it gets it tonight. Thank you, Mr. President.
Thank you, Senator Senjum. Next on my list is Senator Bigham.
Thank you, Mr. President. I'm going to be really brief here. I just want to thank Senator Benson and Senator Rosen, Senator Abler for including me. It means a lot in the discussions about family first and some of the foster care reforms that were brought forward by Senator Rosen from her work on the task force. Those are some big changes that are really going to have a positive impact in the lives of children. From my day job, it will be apparent. So I'm very happy that this body and the other body and the governor are going to make that a reality. Also, I'm very pleased that the mandatory reporter expansion is in here. It's not perfect, but we're going to do some work on it, and I'll continue to work with Representative Becker-Finn on that as well. A lot of work done from her, and appreciate her leadership on that as well. And then I also just want to say because everybody knows how important counties are to me. The overpayment fix for the mistake that DHS made to tribes and counties regarding some programming in the past, to have that made whole is so important to the tribes, but to the counties as well. And so just appreciate those fixes and updates and reforms in this bill. Thank you.
Further discussion on House File 33. Senator Murphy.
Thank you, Mr. President. And members, I want to begin by thanking Senator Benson for her kindness. I am not a member of this committee, nor a member of the Finance Committee, and both Senator Benson and Senator Rosen have been especially kind as I have been hanging out with them and studying this bill. There are just two provisions. There are many good provisions, just two provisions that I want to make mention of, and the first is the Parenting with Disability Study. I know that has many authors and many supporters, but I do want to give a personal shout out to Nikki and Daryl, who have been parenting their beautiful daughter, and this has been an issue for them, and I'm so grateful to see the progress that's being made on that. The other issue that I think is important to raise, and it's a very small issue in this very, very big bill, but it has significant import, and that is the study that is going to happen around maternal health and disparities for women of color, especially black women, and why there is a disparity in mortality and the health of women and children in communities of color. I am grateful that there is money being put into that, into curriculum, into anti-racism study, so we can better understand and make sure that every woman who's pregnant has a healthy child and she lives to raise that child. Very important work. I was really grateful to see it, and I thank the author and the members of this conference who made that possible. Thank you, Mr. President.
Thank you, Senator Murphy. Next, Senator Wickland.
Thank you, Mr. President. I just wanted to make a few comments about what I think is a much stronger and improved bill than either the House or the Senate bill were at the end of our regular session. And I want to acknowledge the difficult task that I felt that the Senate, the House, and the administration had this year, trying to figure out how to deal with all of the federal funds that came in, and then the many rules that followed those funds, the temporary federal reimbursement changes that we had access to, along with our state funding, to put together a really strong bill. And I believe that this bill, it provides very meaningful investments in many areas that will help Minnesotans, and including families and people with disabilities, seniors, those needing behavioral health care, those who are needing to access our local public health system. And while I could speak about, there's many different areas that I have seen provisions that are really meaningful, I feel. I don't want to take the time to do that, but I do want to comment on a couple different areas. One is the maternal health and children's health area. As Senator Murphy mentioned, I want to also comment on my pleasure in seeing that support for the dignity in pregnancy and childbirth section, and the requirement that continuing education be developed that will be made available to direct care employees and contractors who work in hospitals and who care for pregnant and postpartum women, on anti-racism training and implicit bias. I believe that this is one step out of many that we need to take to try to address the disparities that we're seeing in outcomes for women of color and their children. And so I appreciate that that is included, along with the additional provisions to reduce barriers to women of color achieving or obtaining midwife and doula services. I think that language will be very beneficial and will be a start. We need to continue to work on this area. But these are two items that will help. I also am pleased that the provision to provide continuous coverage for women postpartum was extended to 12 months rather than the 6 months as it left the Senate. I think that this really will be have a very significant impact on women and their infants in that first year of life, allowing them to access care for a continuous period of a year. Will really make a difference in their ability to, maintain continuity in care, and hopefully that will also we will see better outcomes for women and their babies. Then in the area of childcare, I wanted to comment a little bit about how I was pleased to see with the strength of the federal funding we received that we were able to provide for so many of the provisions, recommendations from the Family Child Care Task Force. I served on the task force with Senator Kiffmeyer, who was the co-chair, and the report, when it came out in February, I thought had many strong recommendations, and I was hopeful that they would be things that we could see move forward this year, but I was not expecting to see so many of them be able to move forward. The items included things like the federal or the Family Child Care Regulation Modernization Project, much needed to modernize our licensing and regulation systems. The Ombudsman for Family Child Care Providers, the Family Child Care One-Stop Assistance Network, and retain grants, teach grants, the Family Child Care Shared Services Pilot Program. So many of these were discussed on the task force, and that group included many family child care providers and regulators and members from DHS, as well as the legislature. And so I really feel that the family child care providers will be happy to see so many of these moving forward. Also in the area of child care, the rate increases will be are well-intentioned and really meaningful. To have the 40th percentile for infant and toddler rates will be very helpful, and 35th percentile for other ages. I would like to see that we continue to examine the rates and look forward to possibly raising those rates more. Many states in the country have already provided for that and have rates that are closer to the federally recommended 75th percentile. But as a start, I think this is really this is important, and it's good work. Other money will be going to important things that have to do with stabilization of the childcare's workforce, public health grants that will help stabilize providers and provide extra funding for payroll and other necessary needs they have, facilities grants, and so over the 3 to 4 year period that this money will be available, I think that we will be doing very significant things to improve our child care infrastructure in Minnesota. One aspect, though, that I think that is also important to combine with this is a task force that's been set out in the bill, the Great Start for All Minnesota Children Task Force, and this task force will work on strategies for creating a system of childcare, early learning, and development that will ensure that families have access to affordable, high-quality care, and that it ensures that our early childhood workforce is compensated appropriately for the very meaningful and important work that they do. So I think that the task force is needed because the funding in here is not going to solve our child care system crisis, but it will go a long way. And if we put in the energy to understand how to make the system work better into the future, I think that will really help Minnesota out, our economy, and families across the state. So those are a few of the things that I found really were things that I was happy about. I was not as happy to see the reinsurance provision added. I think that I understand that it's an agreement that was made at the leadership level, and I'm not necessarily an advocate for doing so. I think it's costly. I think it does cost a significant amount, and we need to have a more transparent way to target funds to address healthcare costs. And many will be served by the additional premium tax credits. And I understand that there are some who will not be served by those, but I think that we should be examining other ways to address high premiums. So otherwise, I think that there could be more done in the prescription drug cost area. But as always, there are many things that can be done in bills, but we don't get to all of them each budget. So I appreciate the work that went into this and look forward to its passage. Thank you.
Thank you, Senator Wickland. Senator Uyghur.
Thank you, Mr. President. Congratulations to Senator Benson, Abler, Hoffman, to everyone that chief authored or co-authored, or all of us that will be supporting this bill, which I hope will be unanimous. Yes, there's always a continued opportunity ahead. That will always be the case for any bill before us. But a couple items that I wanted to give an additional shout out for Rick Cardenas, who died earlier this year. Senator Hoffman acknowledged that, and he championed the rights for the disabled throughout his 77 years, I believe. He lived in Maplewood for some time, and I got to work with him on so many issues there. And I believe Senator Murphy mentioned Nikki Villavicencio. I don't know if she had the surname in there. And then also Nikki's partner. Having a PCA is a lifeline for Nikki and Darrell and for so many other Minnesotans. And they have continued to present the case for fairness, for the reimbursement for the PCAs. And in Nikki's case, this has allowed her, as well as many others, to be more involved in the community. In Nikki's case, elected to a city council in Maplewood, to be actively engaged in the community, and not on the sidelines, but having a PCA. And as for anyone that knows the role for PCAs, they're like family, very close. So Senator Hoffman, you've been so passionate, have worked so hard on these issues with others. I thank you. And it's a good day for the Senate when we can come together, given all that we've experienced over the past several months. Thank you, Mr. President.
Thank you. Final thoughts on House File 33 to the bill's author, Senator Benson.
Thank you, Mr. President, and thank you, everyone, for comments and critiques. I'd like to thank the staff who we got our target and started digging in, and it has been nonstop. Bailey, Brittany, Larissa, John, Mr. Albrecht, Ms. Kavanaugh, Mr. Monahan, Mr. Hostfeld, Mr. Bodden, and Mr. Nauman, who helped us get through finance. Twice, I think we've been through finance now. The revisers who were able to turn this article around in record time. I'd hoped to get this bill to the House by 9, but we're late. Commissioners Malcolm and Harpstead, appreciated their engagement in negotiation and being clear about what they needed for their agencies. And of course, Senator Abler was a great partner in this, completely focused on his mission. and I think he is pleased with the outcome of this bill. Senator Hoffman, Senator Abler's right-hand man when it comes to getting this work done. Senator Utke and Coran for your contributions to this bill. Senator Rosen for having my back when I was just done. And to our House conferees, especially Representative Schultz and Representative Liebling. We had unprecedented federal funds inserted into this target, which kept the battle for deep tails mitigation always at the forefront. Senator Franzen called it a behemoth. Senator Rosen called it a mammoth. Yes, it's a big bill, and I understand that makes a lot of people uncomfortable. We are fully funding agencies. We are helping moms and babies. We are supporting independence for the disabled, the elderly, for little kids who need nurses in their homes. We are funding dental, but we've added accountability as we increase their rates. We are taking the lessons we learned from COVID, off-ramps for waivers, support for childcare, telehealth, support for local public health, and grants for innovation for public health collaboration. There's a lot of good in this bill, and I thank the people who did the work to get it here. But frankly, I'd rather have a root canal than negotiate dental ever again. And with that, I would appreciate your support.
Members, we're on final passage of House File number 33. With no further discussion, the Secretary will take the roll. Pursuant to Rule 40.7, I will now go to Senator French to report the votes of the absentee members.
Thank you, Mr. President. Senator Carlson votes aye.
Senator Carlson votes aye. Senator French.
Senator Champion votes aye.
Senator Champion votes aye. Senator French.
Senator Dietzick votes aye.
Senator Dietzick votes aye. Senator French.
Senator Eaton votes aye.
Senator Eaton votes aye. Senator French.
Senator Eakin votes aye.
Senator Eakin votes aye. Senator French.
Senator Fateh votes aye.
Senator Fateh votes aye. Senator French.
Senator Herr votes aye.
Senator Herr votes aye. Senator French.
Senator Latz votes aye.
Senator Latz votes aye. Senator French.
Senator Newton votes aye.
Senator Newton votes aye. Senator French.
Senator Putnam votes aye.
Senator Putnam votes aye. Senator French.
Senator Rest votes aye.
Senator Rest votes aye. Senator French.
And Senator Torres Ray votes aye.
Senator Torres Ray votes aye. Thank you, Senator French. I'll now go to Senator Bach to report the votes of the absentee members.
Thank you, Mr. President. I report a yes vote for Senator Tomassoni.
Senator Tomassoni votes aye. I will now go to Senator Johnson to report the votes of the absentee members.
Thank you, Mr. President. Senator Abler votes aye.
Senator Abler votes aye. Senator Johnson.
Mr. President, Senator Coleman votes aye.
Senator Coleman votes aye. Senator Johnson.
Thank you, Mr. President. Senator Lang votes aye.
Senator Lang votes aye. Senator Johnson.
Thank you, Mr. President. Senator Pratt votes aye.
Senator Pratt votes aye. Senator Johnson.
Mr. President, Senator Rude votes aye.
Senator Rude votes aye. Senator Johnson.
Senator Westrom votes aye. Mr.
Senator
President.
Westrom votes aye. Senator Johnson.
Mr. President, Senator Kiffmeyer votes aye.
Senator Kiffmeyer votes aye. Senator Johnson.
Senator Utke votes aye.
Senator Utke votes aye. Senator Johnson.
Senator Miller votes aye.
Senator Miller votes aye. Senator Johnson.
Mr. President, Senator Rarick votes aye.
Senator Rarick votes aye. Senator Johnson.
Senator Gazelka votes aye.
Senator Gazelka votes aye. Senator Johnson.
Senator Newman votes aye.
Senator Newman votes aye. Senator Johnson.
Mr. President, Senator Rosen votes aye.
Senator Rosen votes aye. Senator Johnson.
Mr. President, Senator Goggin votes no.
Senator Goggin votes no. Senator Johnson.
Mr. President, Senator Osmic votes no.
Senator Osmic votes no. Senator Johnson.
Mr. President, Senator Howe votes no.
Senator Howe votes no. Senator Johnson.
Mr. President, that's all I have.
Thank you, Senator Johnson. With all those members who have wished the desire to vote, the Secretary will close the roll. With there being 62 ayes and 4 nays, the bill is passed and its title agreed to. We will now move to the 13th order of business, announcements of Senate interest. Without objection, the following senators will be excused from today's session. Senator Latz from 1 to 1:25 and Senator Klein from 8:15 until the end of session. Senator Johnson.
Mr. President, I move that the Senate do now adjourn until Monday, June 28th at 10 a.m.
Senator Johnson moves that the Senate do now adjourn until Monday, June 28th at 10 a.m. All those in favor say aye. Those opposed say no. Motion passes. The Senate is now adjourned.